So just real quick, a little introduction. Thank you to everybody who's watching live, and thank you for all those people who are going to be watching later at home. I'm Dr. Colin Bartow. I'm the Executive Director of the Central Florida Wellness Council, and one of our goals as the organization is to help create education, to create a center for education where we can bring individuals in, experts on their subject, and talk to them about things. We also have guest speakers coming into our quarterly meetings, and we are starting to gather a library of information that we will hopefully have online and available to the public in the near future. The goal of the Central Florida Wellness Council is really to create a center for service, for education, for networking, to bring together everybody in the healthcare or health and wellness industries so that way we can provide a better service to the Central Florida community. So the webinar series has been a pet project of mine for the past couple months. And last month, Dr. Lauren Hodges, the founder of the Wellness Council, interviewed me about functional neurology. This topic of yoga therapy and brain injury patients is very exciting for me. You can see I'm bringing my hands here. This is something that's very near and dear to my heart, as I also work with brain injury patients. So when I found out that Ella and Bob from Elevate were doing this type of work, I immediately asked them to be the next ones on the topic so we can continue this conversation of brain-based modalities. So without further ado, I'd like to introduce Bob Brandt and Ella Duke from Elevate Yoga here in Orlando. If you guys want to go ahead and say hi.
Hi everyone.
And would you be so kind as to share a little bit about who each of you are and what your credentials are?
All right, I'll go first. My name's Bob Brandt. I'm one of the partners at Elevate Yoga Center, and thank you very much, Colin, for inviting us here tonight. We're very excited to be able to share this with everyone that joins us and listens to the recordings afterwards. But anyways, a little bit about myself. I'm originally from Canada. And the reason I actually started getting into yoga and then therapy in general was when I was a younger kid, I used to help my brother as a bricklayer, and I think my ego got away with me when I was younger, and I carried lots of bricks and I created a back injury. And when I got into yoga, I realized that it started actually really helping my back. And, you know, then I started getting into yoga about 17 years ago. And, well, actually, it might have been a little bit longer than 17. I'm one of those kind of people that just keep saying the same number over and over again. So I'm not actually 29 either. But anyways, I got into yoga about 17 years ago, and I realized that yoga really started helping my back. And then the more I got into yoga, I started getting more intense into that. And then all of a sudden I created some shoulder issues by doing yoga. So then I started getting more interested in, oh, okay, well, how do I help myself by using yoga? So, but anyways, to make a long story short is, with all the different injuries that I've created for myself, it's created an interest in actually helping other people with their issues, whether it be structural issues or anxiety and depression issues. So anyways, I originally finished my 200-hour training in yoga, and then I got so interested in the therapeutic side that I also ventured into the therapeutic side. So then I received my 500-hour, and I'm still in on the track for the 850-hour with the IAYT therapy track. So that's just a little bit about myself. I don't want to take too much time, but
awesome. And Ella, our wonderful black screen over here.
Sorry about the technical difficulties. Yeah, my name is Ella Duke, and I am also one of the partner owners at Elevate Yoga Center. I work closely with Bob in running the studio and developing new and exciting ways to bring yoga and yoga therapy to the Orlando community. In 2010, I was in a really bad car accident that resulted in several broken bones. Just a really dark prognosis of what was going to be. And I used yoga, and I used other forms of alternative medicine to get myself back up and going. And even when people said that I couldn't, yoga said that I could. And so that kind of just sparked the interest in me and the desire to go out and learn and become a yoga teacher. And after I received my 200 hours, kind of just like Bob, I wanted to learn more and I wanted to do more. So I started on the track to becoming an IAYT certified yoga therapist. And so just like Bob, I'm still on that track, just working towards that certification. And it's a lovely thing that I do. And no, that's about it.
That's awesome. Thank you guys. Yeah. Also, coincidence. And are you guys getting feedback as well?
Yes.
Just a little.
Yes.
Okay. Hopefully that clears up. But yeah, I'm actually a yoga instructor as well. It was something I realized my patients benefited from, so I looked more into it. And that's actually how I ran into you guys, is I started doing more yoga. And you guys are right near where I live, so that's awesome. But let's go ahead and get into this a little bit more. Obviously, I'm going to theme this a little bit toward brain injury, as that's my interest, but I will try to keep it open so that I'm asking questions that might pertain to other types of patients as well. So I'm going to let either of you go ahead and field this. You guys can choose who takes it first, or if you guys want to bounce off each other. But really, what is yoga therapy? How is this different from a standard yoga class that somebody would go to?
So yoga therapy is basically the adaptation of yoga practices for people with specific health challenges. Yoga therapist, or a yoga teacher specializing in a specific kind of yoga, will craft a specific posture, a specific sequence of breathing exercises, of postures and relaxation techniques that can help children or adults to have just a better quality of life.
Awesome.
And I'm sure that Bob can expand on that.
Yeah, and I guess to expand on that just a little bit is, obviously one of the big differences really would be there's, the evaluation part, whether it be, if it's a structural issue, or if someone comes into Ella, then, there's definitely the part at the beginning where you evaluate the person, and then there's the assessment stage, or even the evaluation part and the assessment could actually just come from a person like yourself, like a doctor, and we receive that information so we can assess, what is wrong with the person and utilize the information from a medical professional, and utilize that, and then create from there a therapeutic process or a practice for the person. And then after you have that process, then there's the follow-up after that. And based on that follow-up, then you also possibly even have the person, they continue to see their medical professional, like would be someone possibly like yourself, Colin. And then we could actually see the process, because, they'd be coming back and, receiving that ROM, or, the feedback process, basically, as to, is this therapeutic process actually, or practice, working for the individual? And then over time, you see the process and, what happens afterwards. Whereas a lot of times in just a regular yoga class, you'll have a group of people and you're teaching to a group rather than an individual. Although in the therapeutic process, you can have a group of people that are taking similar therapies, like say something like cancer or something like that. You actually have a group of people in that case, and it's actually great for them to have the group, because then they have, you know, the bonding process, because they all went through the same thing. So, but you still kind of work with that group in an individual basis as well. So it does kind of establish a big difference between a regular yoga class, whereas in a regular yoga class, we're taught to teach to the group and not the individual, whereas in therapeutics, it's the opposite way around. You're teaching to the individual and not the group. So there's a big difference there.
That's awesome. That was actually something I wanted to ask, and you guys caught it. It was great. Because when I did my training, it was always, you got to teach to the group as a whole, and you got to find kind of a middle ground, give people variations in both directions. But this seems more along the lines of a directed corrective type of practice. I mean, you're using the principles of yoga, but you're working to directly improve one person's life at a time. And you can put them in a group setting, but you're still focusing on that individual for each step, which for me as a physician is really kind of fun. It's piquing my interest. So how does this work for brain injury patients? I mean, what are we looking at? Because we talked about how, you can take your own assessment or you can take a doctor's assessment, but what does that actually look like for a brain injury patient?
Go ahead, Ella.
Okay.
This is her specialty.
Awesome.
And I'll interject.
Okay. So, when you apply yoga to a TBI, first and foremost, what you're helping to do is that you're helping the injured brain to slow down. And when you quiet the mind, it will heal. So you have millions of Americans that have had a traumatic brain injury. And, these injuries are difficult to live with, and they're really expensive to treat. And there is no actual cure, but one way to alleviate the ailments of TBI is to do yoga. And obviously, somebody with a TBI who has the limited range of motion, the one-on-one therapeutic yoga is going to be key for them. So mindful meditation, mentally focusing on being present, they're all proven and effective tools that are going to help people with cognitive and behavioral issues after a TBI. And that's really just about bringing them to a place where they become okay with where they are right now, and they start to go away from being depressed and feeling sorry for themselves, and they go to a place where they can actually adopt positive and healing habits that are going to help them to get better. So like a brain injury will likely leave most people with decreased mobility, with rigid muscles, with trouble balancing. So yoga is really like an all-encompassing exercise that improves the connection between mind and body. In yoga therapy, we're going to use a series of stretches, breathing exercises that are going to strengthen, and they're going to improve mobility. And that's key, right? Because we want to keep those muscles moving. We don't want stagnant muscles. So yoga can be really big for people that have suffered damage to their left brain or their rational brain, because in yoga therapy, we try to, or at least in my therapy practice, I try to start off by giving them a sequence that they can do over and over and over again. And so the yoga sequence, it links the breath to movement, right? That's any simple yoga practice. And we emphasize that step-by-step progression in a set order. So learning and remembering these movements through repetition kind of becomes cognitive therapy, right? So when we combine all of these factors, the meditation, the relaxation techniques, the sequencing, we create an easy to follow sequence and habits that provide the student with consistent and safe, exercises, and we improve their balance. we get increased range of motion, we add the relaxation, and we improve the cognitive function. So
that's awesome.
yeah. And you know, Colin, it's not a cure-all, but it's an amazing complement to, you know, the already wonderful Western medical advances that are available to TBI patients today.
Yeah, and I mean, that's, I haven't had the chance to speak with both of you about what exactly I do for brain injury and how actually, excuse me, how we look at individual parts of the brain and how we pinpoint all the focal areas that are impaired and direct treatments into that. But one of the biggest things we do in functional neurology is use motor input, and you're using interaction with the world, interaction with coordinated activities. And it seems like you guys are combining that with the breath in a functional method or functional modality that really does almost what I do, which is really exciting. And that, you know, like I was saying earlier, many of my patients have benefited from yoga, and I recommend yoga as a complementary rehabilitative, you know, type of exercise for a lot of my brain injury patients. But to have something that is really dedicated toward what they need just seems like a home run. So, Bob, did you have anything to add on to what Ella said?
Actually, that was really well put.
That was really well put.
Yeah. Yeah,
sit back and let you go.
I would hate to speak after Ella because I don't speak quite as eloquently as her, but I guess if I was to say anything, you know, just as far as like some of the other things like breath work, you know, a lot of these people, you know, they start getting depressed and stuff because of their injuries and stuff. And just working on the breath work in general taps into that autonomic nervous system. So once you tap into that and you work on the breath work, then all of a sudden there's, you know, a whole slew of other things that improve based on that, you know, like your cognitive function goes up, your obviously your breath work goes up. So your sleep improves, your heart rate improves, what else? Like your immunity, your mood, your balance improves. So there's like a huge scale of all kinds of other things that slowly start tipping into the favor of, you know, feeling a lot better. So I guess that's just one thing that I'd like to add is, you know, it's incredible just from regular yoga learning to breathe and then also starting to really apply a lot of that breath work into the therapeutic processes really tips the scales considerably. If anyone needed just one thing to work on, if they worked on their breath work in general, I think it, you know, it helps someone, you know, 95% of the time.
Mm-hmm. Yeah, and that's one of the first things we do when working with brain injury patients or stroke patients, anything like that, is make sure that they have enough oxygen for the brain and enough fuel for the brain. So we make sure that they're eating right, make sure that they've got oxygen so that when you do rehabilitate, it's got the fuel that it needs to do it. So again, that's awesome. And that's part of the reason why I use yoga in general as a, you know, a complementary exercise to the brain, the body. And we definitely have to get that, how the yoga benefits the brain and body talk going soon. So just a couple more things. When we were discussing actually doing this interview, one of the things that interested me was, Ella, I believe it was you mentioned speech.
Yes.
Yeah, can you go to a little bit more about that?
How yoga can affect the speech, the yoga therapy can affect speech?
Yeah, absolutely. Because a lot of the, I mean, even developmentally delayed kids that I work with have speech problems, or if they've had a stroke or a brain injury, they may have speech issues, and that communication is hugely important.
Yeah, I can definitely touch on that. And you know, Bob will definitely be able to expand on the science behind this. He's so much better at this than I am. But you know, in our yoga practice, in our yoga therapy practice, we do a lot of meditation, we do a lot of breathing exercises, and we actually do some chanting. And all of those are geared towards increasing lung capacity. And so when we can breathe a little better, we can speak a little better, right? We're getting a little bit more oxygen to the brain. We're sending more oxygen into all of those crucial organs that we need. So we will do just very simple chants with some of our brain injury clients, and we will see an increase in their ability to speak a little more clearer every time. You know, again, it's nothing that's just, oh my God, this is the cure-all, but there's just that little bit of improvement that just puts a little bit of light into their life and just keeps them going. It's just a little extra push.
Awesome.
Yeah.
Bob?
Yeah, so I guess what I could add to that is, you know, the formulation of sounds around the tongue. There's certain different parts of the tongue that it's very similar to like acupuncture or Chinese medicine and different things like that. I'm sure, Colin, you know about a lot of this stuff already, but the different parts of the tongue and chanting different letters of, you know, some of the Sanskrit alphabet connects to different parts of the body. So sometimes it's similar to having acupuncture, and it'll light up different nervous, subsets of your system. And, you know, if someone had a TBI and they lost a lot of feeling, all of a sudden they may actually create that sensation by doing it through chanting or mantra, and it'll light up those different senses in different parts of their body that, you know, maybe something else in therapy wasn't working before. So it could potentially tap into a different channel, possibly. I guess that would be a good thing to add there.
That is awesome. Thank you, guys. Now, real quick, we're getting a little bit toward the end here, but I wanted to go ahead and talk about this was more of my own curiosity when we were discussing earlier, but yoga therapy as a certification versus a yoga instructor. If you guys could just kind of highlight a little bit of the differences, because I want to make sure that people understand when you're seeing a yoga therapist, this isn't just going to see a yoga instructor for a private lesson. This is somebody who's put time in, a lot of time in, and a lot of studies to make sure that they know what's going on. So if you guys could kind of outline a little bit of the requirements for this credentialing.
All right, so basically there's two different entities out there. One of them is the Yoga Alliance, and the other one is the IAYT. The IAYT is the International Association of Yoga Therapists. So recently, the Yoga Alliance, well, actually, let me take a step back. The Yoga Alliance basically is, it's an organization that basically yoga teacher training schools register with them, and then also their students register with them. So it's an organization, and it doesn't actually have any legal power, but their members pay dues, and we adhere to their standards basically. So they basically say, I'm going to outline, you know, a bunch of protocols that you need to follow to be a school that teaches yoga. And then you have to follow this amount of protocols to become a yoga teacher, basically. So that's the Yoga Alliance. Recently, the Yoga Alliance basically said, okay, well, I'm going to draw a line in the sand. We no longer look at yoga therapists as being under the umbrella of Yoga Alliance. So basically, they're saying, anyone that's certified with Yoga Alliance, they can no longer basically say on our website that you're a yoga therapist, or if you're using our logo, you cannot use yoga therapy if you're using our logo, basically, which is really awesome, because basically what they did was they said, we just cover schools and yoga teachers.
Mm-hmm.
So by drawing that line in the sand, now basically they pointed all yoga therapists to the IAYT, which is the track that we were already on anyways, which is great for us. So what it does is it basically says, if you're a yoga teacher and you're calling yourself a therapist, then, you know, you definitely need to have a lot more training, and you have to take a lot more time and work on this. So that's basically what happened. Did I lose the answer though to the question? Was
No, that was brilliant. Some of the things that I remember we were talking about were, I mean, hundreds of hours of training. This isn't, you know, yoga therapy, or yoga instructors. There's a 200-hour course. There's a 500-hour course, and I believe there's 800.
Yeah.
Yeah. But
so the regular yoga instructors will, you know, get there's the initial 200 hours, which everyone does. Then there's always continuing education. There's so many great programs out there. Some of them right here in Orlando. Whoop, whoop. And, you know, you could always go for your 500-hour yoga teacher certification. And then when you get into yoga therapy, you're looking at, yes, several hundred hours, starting from 850 upward from there. And, you know, it's becoming quite big. Some universities are now offering a 4-year degree in yoga therapy, which is just absolutely incredible. We are so happy to hear that.
It's exciting.
Yeah.
And I mean, you guys are getting training in things like nutrition, mental health, anatomy and physiology, a lot of anatomy and physiology, I'm sure.
Yeah.
This isn't just, hey, let's practice poses. This is actually tying the science and the yoga tradition together in order to create something bigger.
Yeah.
That to me is really,
you know, what's great, Colin, is that more and more physicians like yourself, massage therapists, psychologists, psychiatrists, MDs are seeing the benefits of yoga, and they're coming up with these amazing continuing education programs that they are sharing with yoga teachers and yoga therapists like ourselves, and really just making all of this information available to us so that we can apply it to yoga. And yeah, it's really great the way that, you know, all of these communities are coming together to better educate those who want the education, and also take the yoga to the people that really need it.
Mm-hmm.
But actually, you know what, Colin, you bring up a good point there. Is it's like any other field, though. We have to be very careful as to what is in scope for yoga therapy. We're not trained in medicine. We're not trained in psychology. We're not trained in exercise, diet, or herbs. So basically, once we start telling people about how to do these other things, we're no longer in scope. And, you know, obviously that was the problem that the Yoga Alliance had. They were getting ahead of the curve. There's obviously been some lawsuits about, you know, yoga therapy. So we have to be very careful about, you know, what we say we can do. So we have to stay in scope as to when these people come to yoga therapy, we're only really doing yoga therapy, basically.
Yeah.
And, you know, obviously if we were going to ask for some advice, then we'd go to someone like you and say, okay, well, we need to schedule a doctor's visit to, you know, Mr. Colin, or, you know, we have this nutritionist that we know, or an Ayurvedic specialist, you know, they're certified in, you know, that other piece. So it creates a nice happy family between us all, of course.
Yeah, I was going to say the language is one of the biggest things. As a chiropractor, I was educated about the history of chiropractic, and one of the big things was chiropractic was being shunned by medicine because they didn't understand what we were doing, and we were speaking the same language as them. So when we were able to bridge that gap by using the same language, using the same terminology, it allowed us to make greater strides and work together more. So even though you guys don't have a scope of practice for mental health or nutrition, you're still able to understand what's happening. So if somebody like myself, a doctor, says, hey, listen, you definitely need some yoga therapy, I can write up a note explaining what's going on, give it to you, and you are fully aware of what's happening, and you're able to design the best plan for that person based on my clinical expertise. So that becomes even more valuable to the physician that's referring to you guys, and even more valuable to the patient, because now they're getting, two people on their team speaking the same language, working toward the same goal.
Yeah, that's amazing.
Absolutely.
I think we might have lost Ella.
We lost Ella. Oh, there she is. She's calling back in just in time. There you go. You back, Ella?
I'm here.
All right. So we were just finishing up. I don't know if you caught any of that, talking about the benefits of yoga therapists having all of this extra education, even though they don't technically have a scope of practice yet. And I would love to see that happen. I would really honestly love to see you guys have a state licensure that allows you to do these things, because the amount of training and the amount of work that you guys put in definitely gives you a solid base. We just have to have laws in place that, allow it to happen at the scale that it really could happen.
Yeah.
Cool. Well, do you guys have anything else that you'd like to share about yoga therapy? We're coming up on our time cap. I like to try to keep these about 30 or 45 minutes, so it's easy to digest for most people. But
Yeah.
if you have anything else, please feel free to share.
Yeah. So, if anybody has any questions on yoga or yoga as therapy,
We're losing you a little bit there, Ella.
always give us a call.
Can you go ahead and start that over? Yeah, you were matrixing out there.
Okay. What I said was, if anybody has any questions on yoga or yoga as therapy, they should feel completely free to reach out to us at the studio. At Elevate, we specialize in helping children and adults that have suffered a stroke or a TBI. I personally also work with children with autism, and Bob specializes in adults living with structural or muscular discomfort. So, just anybody that needs any more information or education should really just reach out to us at elevateyogacenter.com.
Perfect. Is there a phone number with that as well?
I'm sorry, say that again, Colin?
Is there a phone number as well that you could put out there?
Yeah, it's 407-777-3713. And I guess just a couple other things outside of what Ella just said is, we also have a minded workshop coming up. It's like an 8-week series for anyone that has anxiety, depression issues. And that's coming up on June 6th. It's just a nighttime class, like a 2-hour class. And then also I have just like a regular series I do every Wednesday. It's just a therapeutic class, and every month I just change it up. I'll do like a low back series or an up back series. Next month's going to be anxiety and depression. I just try to do something different each month, basically.
Cool. Awesome. Well, thank you guys so much for coming out and talking with us. I can't wait to see where this goes. So thank you again. And guys, everybody check out Elevate Yoga. They're a great little studio here in town.
Thank you very much, Colin, for inviting us.
Thank you, Colin.
What an awesome host. Thank you. Namaste.
Namaste. And namaste, black screen, Ella.
Thanks, Colin.
And thank you to everybody who chimed in and everybody listening or watching later on. As always, we're going to try to keep these webinars coming the third Monday of every month. We're going to be trying to bring in other people from different backgrounds, whether it's Western medicine, natural types of interventions, whatever, as long as it's health related. We actually were looking forward to getting some discussions and debates going as well. So if anybody has any ideas on things they would like to see on this Wellness Council webinar, shoot me a message. It's drbartoe@gmail.com. So drbartoe@gmail.com. I'd be happy to get some feedback. And you guys have a wonderful night. Enjoy.